Hello, my name is Melanie Shumate, and I'm a registered nurse. I'm currently in the BSN program at ECPI University. I would like to share with you my experiences during my senior practicum. I chose the Braden scale not only to educate my colleagues, but also to further educate myself on its use. The Braden scale is near and dear to my heart as it aids in identifying those at risk for developing pressure injuries and allows the nurse to use her clinical reasoning to implement interventions in prevention of pressure injuries. I had a brother who developed a pressure injury on one of his heels while in a nursing facility. He suffered great for this. Although skin is my least favorite part of nursing, I aim to reduce incidences of pressure injuries by recognizing those at risk and intervening early. The overarching goal for my project was to design, implement, and evaluate an in-service training session to assist in identifying those patients at risk for developing pressure injuries in the acute care setting. So I started off by identifying articles that were peer-reviewed, literature reviews, and evidence-based practice interventions. I realized early on that there was so much information out there. I barely touched an inch of all the information that was out there. I was able to use my CEU education to gain a better understanding of each subcategory of the Braden scale to be able to use them to their fullest potential. I was able to collaborate with my mentor, and he assisted me in developing my patient-based scenarios for my pretest, which I utilized SurveyMonkey for this. From there, I gave the pretest out to the staff and let them know that it was there for them to do and provided a QR code for them to access it. The pretest results allowed me to develop my lesson plan and my in-service plan, which was approved by my mentor. Next, I collected the results from the pretest. I did find some limitations in that some of the participants skipped some questions, and I can see why, because they were rather lengthy questions. Also, I was unable to give the in-services as I initially thought I would be able to during huddle. Huddle proved to be a difficult time as oncoming staff are trying to get their report and get started on their day, and the outgoing staff are trying to give report and get out of there. So no one's really was able to give me their full attention as I would have liked. So what ended up happening was I did one-on-one in-services to staff mostly and provided my pretest after that. The post-test after that, excuse me. The staff seemed to really enjoy the post-test. There was mostly multiple choice questions, and at the end there was one patient-based scenario that the staff really were like competing with each other to make sure that they were all getting it right. They were excited to come up to me and be like, is this right? Check this, check this. And I was like, I was excited, and I felt empowered by them enjoying my post-test. Um, Only one person missed one, not missed, but she was the only one that identified a lesser risk factor for the patient scenario than the others did. But as I told her, there was no right or wrong when she did identify the patient was at risk for developing pressure injury and interventions was put in place. So she did a great job of that. Evaluation came when I evaluated the pre-test and the post-test. And as I stated earlier, the limitations on the pre-test was that some skipped some of the questions and not as many people did the pre-test as did the post-test. However, I still have people coming up to me during the last few days and asking me about doing my pre-test and post-test. And I, let them do it, but I'm like, the whole project is over now, but you can still do it, which is exciting to me because we can still go on with staff education. I have put up my cue cards on our board so that staff can identify different diagnoses that affect the different categories of the Braden scale. So ongoing education is going on. I did do a project analyzation paper outlining what all I learned during the project, because I learned about various conditions that affected the subcategories that I didn't even know about, like Raynaud's and sensory perception, Hallervorden and spots, and the immobility and sensory perception from those. There's just a lot of disease processes out there that we don't think about that affects and impairs skin. I feel like the staff did increase their knowledge base when it came to identifying those at risk using the subcategories of the Braden scale and the diagnoses, and that there's more consistent scoring with the implementation of patient-based scenarios. And I feel like the staff will have improvement in patient outcomes as they do intervene early and get those patients those things that they need in order to prevent pressure injuries. So for future education, I would start early, cut down on the wordiness in my questions, and try to get instructions out there for the staff to make sure that they do answer all the questions, try to get the maximum participation as I can. And I would like to continue to do these in-services yearly to keep staff involved and engaged in pressure injury prevention, and continuing to learn new evidence-based practices for the prevention of pressure injuries. In summation, the Braden scale should be used as a risk assessment tool in combination with clinical reasoning skills to reduce risk to patients for developing pressure injuries. It's been shown that consistent scoring requires training, which includes scenario-based education. It is not about right or wrong, but consistent scoring and intervening to prevent occurrences of pressure injuries that prove costly to patients and our healthcare system. Prevention requires an interdisciplinary team approach as suggested with consults for speech therapy, physical therapy, occupational therapy, the physician, the dietitian, and the healthcare technician. I would like to thank you all for joining my in-service, my project analyzation, and if you have any questions, I will take them during this time. Thank you. You guys have a great day.